Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
The Health Secretary, Matt Hancock, has been criticised by the head of the UK Statistics Authority over the way the government presents figures on testing for coronavirus. Sir David Norgrove said the data is still far from complete and comprehensible, which means it's not surprising that the statistics are so widely criticised and often mistrusted. It comes as 324 more deaths have been recorded in the UK in the last 24 hours. 39,369 people have now died. Here's our health editor, Hugh Pym.
A drive-in testing centre today, but with very little activity, as a new debate on precisely how many virus tests are being carried out has flared up. The Health Secretary, Matt Hancock, made great play in recent weeks of the plans to boost testing.
I am now setting the goal of 100,000 tests per day.
Currently, just over 50,000 tests available.
I can announce that we have met our goal.
But today he's been criticised by the head of the UK Statistics watchdog over the numbers, who casts doubt over how many tests have actually been carried out and on how many people. In his letter, Sir David Norgrove welcomes the addition of some new data, but adds, "I'm afraid, though, that the figures are still far from complete and comprehensible. The way the data are analysed and presented currently gives them limited value. The aim seems to be to show the largest possible number of tests, even at the expense of understanding."
I know
the Health Secretary was challenged by Labour in the Commons.
The UK Statistics Authority have written to him today saying that his figures are still, quote, far from complete and comprehensive, that the testing statistics still fall well short of standards in the code, and that it is not surprising that testing data is mistrusted. I mean, this is quite damning, I have to say, to the Secretary of State.
we will work with the UK Statistics Authority to make sure that they are happy with how we're publishing that data, to make sure that we get the data published in a reasonable and sensible way.
The daily figures published show tests for whether people currently have the virus. In one recent day, over 128,000 tests were provided. 27,500 were for NHS staff and patients. Around 29,400 were people getting tested at drive-in centres. Nearly 44,000 were test kits sent out, though not yet returned. Nearly 28,000 were for research and antibody tests, finding out whether someone's already had the virus. The number of people tested isn't currently published. Officials say it will be restored soon after data checks. Some, like Michael, have reported delays getting results.
They said, don't call back for 5 days. I then phoned back 5 days later. They said, no, actually it's now 7 days. I phoned back 7 days later. Then it was 9 days. I would just perhaps get some form of confirmation or not. And I haven't since, and that was nearly 2 weeks ago.
The government wants to extend testing and tracing of people who might be infected in England, but today's developments confirm there are still many questions about how the system is working. Hugh Pym, BBC News.
The government's not just facing pressure over testing statistics. Boris Johnson's ambition to reduce the coronavirus alert level at the same time as lockdown restrictions loosen was blocked by all four of the UK's chief medical officers. Our economics editor Faisal Islam is with me now. So is the government still following the science on this?
Well, balancing off reopening the economy after its historic falls with keeping a lid on a deeply contagious pandemic is a delicate, difficult task. The government proposed to do that and communicate it to the entire population about a month ago with that PM's address and that traffic light system, the COVID alert level, 5 points there. And at that time, the PM said, and in a document that came out later, that there would be a sort of connection between that alert level and the lifting slowly of the lockdown. Now, what happened last week was the Prime Minister announced that he was going to have a meeting and he hoped to bring that alert level down from 4 to 3. But that didn't happen. It stayed at 4. And our understanding is that all four chief medical officers from the four UK nations, including Chris Whitty, but also the CMOs from Wales, Northern Ireland and Scotland, they felt that things that transmission was too high to bring that level down, which shows just how delicate the situation is. It may explain why some of the scientists, there's been a bit of a backlash over the weekend, and it shows just how careful that balancing act is between opening up the economy and the health risks that still endure even as the pandemic slows down.
Faisal, thank you. Well, Matt Hancock, the Health Secretary, has been accused of misleading the public over coronavirus testing figures. The chairman of the UK Statistics Authority said the government appeared to be presenting the largest number possible at its daily briefing at the expense of understanding, as he put it. Well, let's speak to our political correspondent, Carl Dinnan. So, Carl, just how significant, then, is this intervention?
Well, ministers do have to take the statistics watchdog seriously, otherwise their credibility can be seriously damaged. And today, Sir David Norgrove, who wrote this letter, was absolutely scathing about the government. He said it is not surprising that, given their inadequacy, data on testing are so widely criticised and often mistrusted. Now, his principal complaint will be familiar to many people, and it is that the government still counts tests that are put in the post in the same way as it counts completed tests. And the truth of the matter is, nobody knows how many of those posted tests are actually completed because the government doesn't publish that data. But it does use the posted tests to show that it has reached its targets on testing, which is why there's so much scepticism about it. Now, Matt Hancock, who you heard a few minutes ago, was asked about this at the press conference, and he said that the way the government presents the stats is the simplest way of presenting a very complex picture. But he added that they are still working with the UK Statistics Authority.
Now, we were always told that one of the keys to lifting the lockdown was having an effective test and trace operation in place. The lockdown has now been eased, so is test and trace up and running? Matt Hancock said today it was, quote, working well. But this programme has exclusively seen a leaked copy of data showing how it was operating in its first few days. It shows less than half the contacts reported to NHS Test and Trace by those who had been tested positive had actually been reached by contact tracers. Our health and social care editor, Victoria MacDonald, has this report.
The answer is the new NHS Test and Trace service.
We were promised a UK-wide test and trace system by June the 1st that would be world-beating. A big claim when countries like Germany and South Korea have had their systems up and running for months. Today, the Health Secretary was asked how the system was working.
He asked rightly about the NHS test and trace capability. That is up and running and working well. He asked how I can say it's working well. It's working well because thousands of people have been contacted and are being traced. Their contacts are being traced, and so the system is working.
However, Channel 4 News has been shown the initial results, how many people have been tested and how many contacts traced, and it reveals it has barely scratched the surface. From Thursday, when test and trace began, to Sunday morning, we've seen figures which show across England 4,456 confirmed COVID-19 cases were reported to the system. Of those, 1,831 have self-registered on the website or been called and completed the NHS test and trace form, providing information about their contacts. The number of contacts they provided was 4,634, of which only 1,749 have actually been contacted.
The only tracing that continued after mid-March was in hospitals or care homes if there was an outbreak. And the government spent the whole of April focusing on hitting a testing target rather than putting in place this vital infrastructure. And this test, trace and isolate regime is absolutely key to the safe easing of lockdown.
There are some, however, who point out this is early data and it was collected over a weekend.
Provisionally, about 40% of the contacts have already been contacted, and of which 40% of the contacts provided have also been contacted. It's important to interrupt the chains of transmission, and by doing so, we can help reduce the spread.
So use the stickers to help you guys.
Yesterday, primary schools started to reopen, and even some people who had been shielding because of their health were told they could go out, despite some of the government's own scientific advisors warning that easing the lockdown should only happen when there is a fully functioning test and trace system in place. And we've had a response from the Department of Health and Social Care tonight. They've said these figures are outdated. We did say they were only till Sunday morning, and failed to reflect the huge amount of work already underway, with thousands of people already contacted in just a matter of days and their contacts successfully traced, which is slightly to miss the point. The point was we were told that this was going to be a world-beating system and would need to be in place before ease of lockdown, and of course that hasn't happened. There's another point there you would have noticed. Matt Hancock, the Health Secretary, saying in the Commons today that before they could release these figures, they needed to finalise them with the UK Statistics Authority. Now, that is because they had a stinging rebuke from that authority today, saying that whenever they release data on testing, that it is misleading the public over the number of tests. They're saying it's far from complete and comprehensible. The aim, the authority said, seems to be show the largest possible number of tests, even at the expense of understanding. So quite clearly they're wanting to be more careful with these test and trace figures.
Thanks very much, Victoria. Well, joining me now to discuss the NHS track and trace data which this programme has seen is Anthony Costello, Professor of Global Health at University College London. He's a former director at the World Health Organization and a member of the group set up, the Independent SAGE Group of Scientific Advisors. Anthony Costello, what do you think these figures showing the tiny number of people really so far contacted, Department of Health says they're out of date, but what do you think we can draw from them?
Well, over 3 days, you would expect from the ONS figures that there would be 24,000 cases in the country. And the confirmed lab cases were only 19% of that. And of that, considerably less than half completed the NHS Test and Trace website. And on average, they reported 2.5 contacts per case, which is very low, although, of course, there is social distancing and self-isolation.
And also, quite a number of those cases the ONS are detecting could be asymptomatic, correct?
Sorry, I missed that.
Yeah, sorry, I think we had a technological fail just there, but I was just saying that quite a number of those cases that the ONS are detecting could be asymptomatic, so hard to test and trace those.
That's true. That is true. So we're picking up, maybe 20 to 30% of cases. It's, as I was saying, it's not world-beating. It could miss a very large proportion of cases. It probably misses 2/3 of contacts. And it probably explains why 25,000 contact tracers are twiddling their thumbs, because they only had to chase 4,600 over 3 days. So, look, it's not fit for purpose yet. And that was why Independent SAGE called for a 2-week time frame and before you open schools, so that you could set this community shield up to run properly. We certainly need much faster speed of test results. We also need to lock down cases and contacts as soon as they have symptoms, not as soon as they have a test result, maybe 2 or 3 days later, which allows things to spread. And we need to know about the contacts. Are they isolating? Are they complying with this isolation? Do they have the financial incentives you need to keep you at home if they're having to go out to work?
Yeah.
Do they have facilities to isolate? There are big questions here.
Very briefly, how quickly could this system become world-beating in your view?
Well, I think actually there are some worrying things about this. To make it local, integrated with GPs and public health and sustainable, I think they're going to need to change the way they do it to make sure that data gets to the people that will care for them. And ideally, I'm not sure a call center contact tracing system is really going to work, because it won't have either the speed or the trust that would come from a more localized system. So I think
Anthony
quite
Costello,
a lot of changes need to be made to the system. I think it will take 2 to 4 weeks.
Anthony Costello, thanks very much for joining us. Sorry about the quality on that.